topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, South Florida. Welcome to another Ask the Expert show, where for the last 16 years, we have brought you the top experts in the field of legal, health, finance, home improvement. I got to tell you something special about this show. We started getting questions in, people going, not if we have a neuropathy specialist, but they keep asking us, we hear about this neuropathy. I'm wondering if I have it. How come you don't do a show on that? And the more we looked into it, the more we found there are so many people who do not know what neuropathy is, and they sure don't know the top specialists in the South Florida area. We found Dr. Andrew Cherry. Good afternoon, Dr. Cherry.
Hey, good afternoon, Steve. Thanks for having me. Good to be here again.
You know what? I love your show because I know there's so many people out there who suffer from neuropathy and they don't have to. First of all, tell people about your practice.
Well, thank you. About 28 million people a year suffer with nerve damage that affects their feet and their hands, their lower legs or lower arms. That's what nerve damage does to people. It's called neuropathy, disease of the nerve. And I am a nationally certified and board licensed chiropractor in the state of Florida. And my main focus in my office is to help people that are suffering with this condition to actually have a chance to heal and recover and get, their independence back and spend more time with, their loved ones when it comes to being outdoors and going on vacation, get better rest. And just feel like a normal person like they deserve to at this stage of the game. I appreciate being here. I want to help answer some questions and help people get a better understanding of, what we actually do to help get people's life back in order and help these nerves heal.
Dr. Cherry, you're one of the top chiropractors in the state of Florida. What made you decide to start working with patients with neuropathy?
Well, Steve, that's a good question. And I have to say that for the first 20 or 22 years or so, I actually failed in helping people with neuropathy. I tried traditional chiropractic approaches, physical therapy approaches, ultrasounds, muscle stimulation therapy, acupuncture. I just found that nothing actually helped these people to recover, not even when I referred them to the medical specialist, like a neurologist or a foot specialist, podiatrist. It just seems that there was no answer. So I studied more about the anatomy of the nerves and what the components of those nerves are that actually wind up being damaged, that cause everybody's misery, learned the approach to treating that. And now we have a 95 to 97% success rate in helping these people get better. It's amazing.
It is amazing. We get a lot of letters, people who said they went to their doctor, and you're going to have to help me with this. They prescribed them this it seems like everybody gets prescribed the same thing. Yeah. But now I'm starting to read that there's people are having bad effects. What is the difference between what you do and say an MD does when it comes to neuropathy?
Yeah. So, most of the time with people that develop this kind of nerve damage that really interrupts their, normal life, people go to their medical providers because that's what they're, trained to do when they don't feel well or have a health problem. They go to a medical healthcare provider, and they actually accept the insurance. And the doctors tend to run some tests sometimes, like a EMG, electromyograph, or a nerve conduction study. And in most cases, they find it's a positive test. And in most all cases, the doctors tend to write prescriptions like gabapentin or Lyrica, the most commonly prescribed drugs, which have been designed for epilepsy and seizures, not to help the nerves heal, to get patients back to normal. And because these drugs are written as an off-label prescription, meaning that's not what they were designed for, but these doctors don't have any other go-to medicine, they write these off-label prescriptions for people not knowing what else to do. And I realized that after over 20 years of practice, with my patients came back and said, all the doctor did was write me a prescription for gabapentin or Lyrica. So I had to dig in and learn. So there's 3 parts of the nerves that are actually damaged that are leading to all the symptoms. And those parts include the very small micro vessels that wrap around and surround the actual hair-sized nerve endings to bring oxygen and nutrition to the blood, to the nerve's cover. The cover is the next component, which is called a myelin sheath, and its job is to allow for normal signals to pass across the nerve. If there's not enough blood supply, not enough oxygen and nutrients, the cells that make up that cover, called Schwann cells, basically they suffocate and start to die. And then the patients tend to develop numbness or tingling or even burning as some of the very first symptoms that the nerve is going through its death cycle. And then once that cover gets damaged, it cannot protect what's underneath of that cover, the third component, which are the different types of nerve fibers. And they transmit anything from, hot and cold and warm to light touch to sharpness and vibration balance. So these 3 components, the vessels, the cover of the nerve, and the nerve fibers, make up what is causing all the symptoms. And that's exactly what we treat. So treating the root cause allows us to have a 95 to 97% success rate with our patients. That's the difference.
This is from Nick. He's actually in his car driving. I hope he pulled over. He said, I'm listening on Spotify. I'm really enjoying the show. You just said numbness, balance, and tingling. Where would that be at on the body?
So when it comes to balance problems, we're talking about the feet, and the numbness and tingling and burning would be in the feet. Peripheral neuropathy affects the extremities, either the feet or the hands, and then it can work up the legs or up the arms.
Pete in Fort Lauderdale wants to know, what happens if you don't take care of neuropathy?
Okay, well, that's a really important question that requires a really important answer. Because there's a vascular component involved and there's damage to these small vessels that, disables the ability for the body to bring blood that carries oxygen and nutrients to the nerves. Every passing day that goes by without oxygen and nutrition to the nerves will allow this to progressively get worse over time. Some people progressively get worse fast, some are slow progressors, but due to the nature of the constriction of the vessels and the lack of oxygen and nutrients, the tissues will continue to progressively die. Something needs to be done about it as soon as possible.
Yeah. Is there a certain demographic, male, female, age group that you see suffering from neuropathy?
Yeah, it can happen, really any age, 20s, 30s. Most prevalent is usually in the 70s to 90s. And usually the most common cause of the damage to those 3 components, I'm going to keep repeating that, the vessels, the nerves cover, and the nerve fibers, the most common cause is diabetes. And diabetes is a blood sugar problem. Well, the sugar in the blood destroys the lining of the vessels, like shards of glass passing through your vessels, destroying them and causing inflammation and not allowing for oxygen and nutrients to get through. So there's got to be some control with the intake of sugar and not just put you on a GLP-1 drug or a metformin or something to control sugar instead of you controlling the sugar intake. Other major causes is chemotherapy induced, which we still get great results. Just takes a little extra time, a little extra diligence of patients. Old accidents and injuries to those affected areas, the feet or the hands, can cause nerve damage. Poor metabolic health, meaning you just may not have taken the best care of yourself over time. That can develop into nerve damage. Being overly medicated in your lifetime due to health conditions, any and all of these circumstances can lead to the damage to the components of the nerves that we're talking about that cause all your nasty symptoms.
Here's a great question that came in. This is from Vince in Lake Clark Shores. I don't know where that is, but he said, I don't understand. I've had 2 doctors tell me that there's no cure for neuropathy, and you're saying there is. Can you explain? You've actually done it.
Well, yeah. I mean, the majority of my practice helps people recover from nerve damage that have been diagnosed by medical doctors. Well, unfortunately, what was his name? Steve?
Vince.
Oh, Vince. Sorry. Vince, unfortunately, these medical doctors, they mean well, and we need them in the society. But when it comes to peripheral neuropathy, from what I learned over decades, is that they just honestly don't know how to treat it. And eventually, they will tell you there's no cure, but that's because they couldn't find the right cure themselves. So if they can't find it, then there is no cure. That's what I have found. And writing prescriptions to cover up symptoms that are not addressing the cause of the symptoms is not a way to treat patients. That's why they're frustrated and they tell people there's no cure. However, again, if we treat those causes, those 3 parts that I mentioned, vessels, the nerves cover, and the nerve fibers, then you actually have an opportunity to heal. And that's what we do every single day for years now. I might add also, Steve, I might add that once we find that you have neuropathy, the treatment that people do is done mostly from home with simple devices that help your circulation, that re-educate the nerve fibers that are damaged, and help the cover of the nerve heal. It's actually a pretty simple approach for such a debilitating condition. So I offer everybody a free consultation. So you can come in and discuss with me what's going on with you. We review your history, and then we'll discuss in detail, what we do to help people get better and how we can help you. It's really important, if you have this, to take advantage of our free consultation. We have normal business hours Monday through Friday, and we're available most of the day with very little wait time to help as many as we can.
How do you determine if they have neuropathy?
So there is a specific neurological sensory testing that we do, since there's different types of nerve fibers that transmit different sensations, like, one for hot and one for cold, one for sharp, one for light touch, etc. We're going to test those simply enough with simple tools we have in the office. Generally does not hurt. It doesn't take long. And we will discover if it is neuropathy and the level of severity. We have a chart that, is a severity chart that goes from 0% damage down all the way up to permanency, which is over 85% damage. Depending on where people fall on that chart, that level of severity, that's what's going to help us determine what treatment is needed to help them get the best result as soon as possible. And treatment time, we're dealing with hair-sized nerves and hair-sized vessels. And we have learned that the process takes time. You will have to be a patient. Healing the nervous system, the control center of your whole body when it's damaged, just does not happen overnight. So the treatment time can take anywhere from 3 months to 12 months, depending on the level of severity. So you have to be patient in the process of healing. You will have to be compliant, because we have figured out that special recipe that it takes to heal and get better. And it's just really important to understand that there's no rushing improving your health. It's a process. We'll help you with it, and we'll get you there.
Greta in Aventura wants to know, is there anything I can do, whether it's diet or with supplements, to keep from getting neuropathy?
So prevention of neuropathy is going to boil down to how well you take care of yourself. So definitely, I don't like the word diet, but proper eating habits, putting the right types of food in your body will certainly help your cells function more normal and reproduce healthy cells. Getting the right amount of exercise and type of exercise, having enough rest, 6 to 8 hours of sleep a night. Having a healthy functioning nervous system is crucial to being healthy. That's where chiropractors come in naturally. And having the ability to help reduce your stress, doing stress reduction exercises. These are the components to being a healthy person on earth that I know of after practicing for over 33 years, that we all need to get back to doing better so we can improve our health while we're still here. If you don't do those things, you're likely to develop health problems, including neuropathy.
Here's from Ben in another Fort Lauderdale. Wants to know, I'm really enjoying the show. I did not even know there was a such thing as neuropathy. I'm 65 years old. I have found myself losing my balance, and I have felt tingling. I just thought it was just another health issue. Why are there so many symptoms when it comes to neuropathy?
Yep. Well, sorry you're going through that. It sounds like you may have symptoms of neuropathy. And I mentioned a little bit earlier that there's different types of nerve fibers, which is one of the components of the condition. The other two are the vessels and the nerve's cover. Well, under that cover are different nerve fibers. There's different types. There's small fibers. There's large fibers. They transmit different information to the brain so that if you're stepping on something hot or cold or sharp, or if it's vibrating, even balance. So your receptors in your feet tell your brain where your feet are so you can actually stand there and have good balance. And the reason there's so many symptoms is because there's so many different types of receptors.
Here's Kenneth in Boca. Thank you for your show. I think it's going to help a lot of people. Why is neuropathy it seems like it's for older people? Do you ever get younger kids in their teens and or early 20s with neuropathy?
Excuse me. Generally, no. People in their teens and 20s don't have peripheral neuropathy. It seems, unless it's traumatically induced, where you had an accident directly to your feet or leg or hands or lower arms, then it's developmental, generally speaking, through, how well you've been taking care of yourself, what you've been eating. Again, diabetes is the number one reason for diabetic neuropathy. Chemotherapy, can't do much about cancer, but take better care of ourselves to prevent that. Prevention is a large part of the battle when it comes to all health problems. Some people do a good job at taking care of themselves. They less likely develop health problems, including neuropathy, and other people don't do a great job at taking care of themselves, and they can have a vast array of health problems. And you may have, blood pressure issues, diabetes. You may have digestive issues. You may have a spinal column issue, low back pain, sciatica, leg pain, and peripheral neuropathy. Our bodies are amazing things, and we can develop several problems at the same time, unfortunately. So it's great just to get back to the basics and put the right healthy food in your mouth and drink, which is water, by the way. Get your exercise, get enough rest, see a chiropractor for a healthy nervous system. That's the control center of everything. And do what it takes to help do self-stress reduction exercises. Those are the components of health. That's how we're supposed to be healthy. Then we won't need the medicine that the doctors give us that doesn't address the cause of your health problems anyway.
Rocky in Delray wants to know, how long would it be before I would start noticing a difference going on your program?
Yep, very good question. So what I have found is that usually within 4 to 6 weeks, people are reporting to us that their symptoms are improving. On average, in the first 3 months of care, which is at the point which I would do a re-examination, we find that people are at least 30 to 50% better, if not more. And there are a lot of people that are better than 50%. And that boils down to the following. The typical reasons people respond differently include their age. Of course, everybody knows that the younger you are, the quicker we heal. So age matters. How you develop the neuropathy, how long you've had it, the level of severity, how compliant you are to the care. These are factors that determine how well people respond. So we'll help you understand the best thing for you so you can get the quickest result. But it's very important to understand that it is a time process. We have to be patient. It's a marathon and not a sprint when it comes to healing hair-sized nerves, hair-sized vessels, and our nervous system.
Linda and Davey, great show, Steve-O. This is a perfect guest to bring on, especially down here in South Florida. I would like to know what other areas does the doctor treat?
Thank you, Linda. I am a chiropractor. I focus on nerve, muscle, and joint issues. We handle any type of musculoskeletal pains, nerve injuries, auto injury related sports injuries, even children, any joint in the body, neck, shoulder, elbow, wrist, back, hip, knee, ankles. We do physical therapy as well. We don't just focus on people with neuropathy. We'll help anybody that wants to improve their health. Our main focus is healthy nervous system. That is the control center of everything in your body. By removing interference in the control center, you will heal yourself. That is the whole premise of what I do for a living for over 33 years. No medicine.
What I love about your practice is, and chiropractors in general, is you are doing some of the most amazing things. I've heard of people that didn't have to have knee surgery or didn't have to have back surgery because their chiropractor saved them. That's pretty amazing.
Pretty amazing. Unfortunately, in my profession, there's not much education about chiropractic care from when we're young till we get older. And so people don't understand the true benefit from it. And unfortunately, a lot of times we are a last resort for people. They tend to reach out to the medical community, traditional medical community, and are not aware of how much we can help. And so that's one of the reasons that I am constantly out there doing things like this podcast. Yeah. Thank you very much. I'm on social media. I'm on the television. I do seminars. We talk to our patients about talking to family and friends. And if you're somebody listening to the show and you've never been to a chiropractor, then your nervous system is not where it should be. And amazing things can happen for you by seeing a chiropractor. I am very gentle. I am not aggressive. This is a very conservative, gentle approach we use now. People tend to respond very well because once again, when we remove stress from the control center of your body, you will heal yourself, sleep better, feel better, function better, inside and out, bodily functions, immune system, and just have a better quality of life and live longer. There's many, 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 many unlimited studies on this, proof of this through chiropractic care.
Dr. Cherry, tell people how they can reach you. I know we're running your information below, but for all those who are listening on Spotify and radio and Facebook, how do they reach your office?
Well, you can call us directly at 754-227-9640. You can look me up online. I'm drandrewcherry.com. And you can type the whole thing out, or you can abbreviate doctor to drandrewcherry.com. You can text us at that 754-227-9640. Best way is on the internet. I am all over the web. My office is in Cooper City, which surrounds Davie area, Pembroke Pines, West Hollywood, Miramar. I have patients from Broward and Miami-Dade counties. Most of the treatment's done from home. You don't have to come to my office all the time. We hope to see you soon for your free consultation.
If you're in Palm Beach, it's worth the drive, I'm telling you. Dr. Cherry's with us every month. Dr. Cherry, thank you so much. Look for my email after the show.
Will do. Thank you very much. Have a great night.
It's Dr. Andrew Cherry. That's it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.